We begin at 5 with COVID-19 tightening its grip on Oklahoma's hospitals even more. Today, the number of people currently hospitalized topped 1,700. Just 24 hours ago, that number was below 1,500. It's the highest count since this time last January. And out of those 1,700 hospitalizations, nearly 70 of them are Oklahoma children.
And that is an all-time high and a big concern for local doctors as the full impact of COVID-19 is still not known. News 4's Austin Brissett hearing from experts today. And Austin, what are doctors telling you about this?
Well, Kevin, Heather, doctors with OU Children say they are experiencing the same issue staffing-wise as other places around the metro. And with the Omicron surge, they're seeing more patients on average with a slew of different COVID symptoms and issues.
We are at an all-time high for admissions, for pediatric admissions for COVID-19.
Over 9.5 million children have tested positive for COVID in the U.S. About 1 million of those have come in the last week alone.
Some people have suggested that we should all just get Omicron and get it over with, and I would push back on that, especially with regards to our children, because there are still many things to learn about this variant.
Almost 70 kids are in Oklahoma hospitals right now fighting the Omicron variant, and its long-term effects are not known, especially when it comes to things like multi-system inflammatory syndrome, or MIS-C, a post-COVID complication and something they're seeing a little more of in children as cases have risen.
Although COVID may be seen as a mild disease, there are some severe complications that can happen from it.
Doctors at OU Children's are saying a lot of patients are able to stay home or see family doctors with normal symptoms, but they're also seeing a lot more with COVID pneumonia, bronchitis, and dehydration in younger patients. Some have even had inflammation in their brain, causing issues with seizures and more.
And we're also seeing strokes because we know that COVID makes people of all ages more likely to clot.
Not to mention more patients overall. Over the last 3 weeks, OU Children's bed surge averaged 12 people. Wednesday, it's at 20. In the ICU, they averaged 5 people. Now that number's at 8. And more patients continue to test positive. Late last year, the typical positivity rate was about 1 to 1.5% when testing their patients before an operation. In the past few weeks, that number's at 13%. And with a lack of staffing, the problems continue.
So that has significantly hampered our ability to continue to function as a normal operating room.
Well, COVID-19 has been put in the top 8 causes of death for children.